There we go. Hi, hello everyone. Welcome back to the Lupus Foundation of America's live report from the American College of Rheumatology Annual Scientific Meeting 2017. With me this afternoon is Lyna Merzoug, pardon me, who is our Senior Research Coordinator at the Lupus Foundation of America. And she's going to be discussing with us the highlights from the Lupus Foundation of America's needs assessment to really talk about the diagnosis of lupus from the patient's perspective. So, Lyna, welcome. Thank you.
Sure. Hi. Thank you for having me.
I certainly appreciate it. So let's begin by just telling us a little bit about the patient needs assessment or the survey, and what's the significance of doing this kind of a survey?
Sure, yeah. Okay, so the findings of the survey are actually part of a larger study that we distributed to patients and physicians. And what we found, what we asked them was basically we wanted to understand really what the path to diagnosis is like, and also learn more about the resources that are important to them. So we know from what physicians tell us that there are many factors that lead up to delayed diagnosis, but now we have the data to actually back these, to support these findings. So what we did is that we surveyed 3,000 individuals and asked them a variety of questions that include, we surveyed individuals who are living with lupus, and we asked them questions about who they're seeing, what kind of doctors they're seeing, where exactly those doctors are, and how long it took them to get diagnosed with lupus. So we took all of that data and we actually found some pretty significant findings.
Great. And those findings are going to be presented here at the American College of Rheumatology conference, right? Okay,
yep.
Sure. Now, what I'd like to ask you now is, can you just give us a few highlights of what you learned from this survey?
Sure, definitely. So we found that leading up to diagnosis, more than half of individuals reported being told that there was nothing wrong with them or that their symptoms were simply psychological. And so we know that's definitely devastating, and that definitely delays diagnosis. And we know that lupus is a progressive disease, so that does cause a lot of damage.
Yeah, and I know that I hear from a lot of people with lupus who say that, people sort of wonder if it's not all in their head. And after a long period of time going through all that denial from others, they start to begin to think, well, maybe it is me. And this survey really points out that it's really, there are a lot of misunderstandings about the symptoms of lupus among the health professionals. So what's the next steps for this needs assessment? What do you expect to do now beyond publishing this data here or presenting this data here today at ACR?
Yeah, sure. Well, before I get to that, actually, so we also did find that there was an overwhelming 40% of individuals who waited more than 1 year from the onset of their symptoms to receive an accurate diagnosis. So we do hope to use the findings of this study to help come up with solutions for this issue and help to shorten that time to diagnosis. We also found that a lot of patients now are wanting to connect more with their community and connect more with other lupus patients or physicians or just others who are also working with lupus. So that's why we launched Lupus Connect. And we also hope to do more work on medication adherence and help support our physicians and support their research and help fill those gaps in the clinics.
Great. And for those people who aren't familiar with it, Lupus Connect is the Lupus Foundation of America's online community, and you can access it through our National Resource Center on lupus at resources.lupus.org. So I sort of jumped the gun on that final question here, but can you tell me a little bit about what are the next steps for this data?
So we're hoping to publish more of these findings and be able to share more of those findings with you guys in more of a formal publication and just use more of what we find to develop more resources for our constituents and hopefully shorten that time to diagnosis and be able to support more of these individuals living with lupus.
Are you going to be diving more into from the perspective of the clinician, of the doctors?
Yes, we do hope so.
Okay.
Yes.
But there's no specific plans yet at this point? I mean, you're right now you're focused on the patient.
Definitely. Yes.
Well, good. Well, Lyna, thank you very much, and I hope this has sort of been informative to our Facebook fans and our audience. We'd like to remind you that tomorrow we have 2 more live broadcasts, which are going to focus one on big data and how big data can play a role in understanding about clinical trials and improving the design of clinical trials. And also, we're going to be reporting on some of the results reported here at the ACR about clinical trials to develop new therapies and new ways to manage lupus. So we hope you'll tune in to us tomorrow. And until then, we wish you very much a good day, and thank you very much for tuning in. Thank you very much.